There is still much uncertainty about the pathophysiology of hypertension. A small number of patients have an underlying renal or adrenal disease as a cause of their raised blood pressure. In reminder, however, no clear single identifiable cause is found and their condition is labeled essential hypertension. Among these factors, some are considered play an important role, such as cardiac output and peripheral resistance, renal angiotensin system, autonomic nervous system, endothelial dysfunction, and genetic factors. The maintenance of normal blood pressure is dependent on the balance between the cardiac output and the peripheral vascular resistance. It follows that patients with hypertension may have an increase in cardiac output, an increase in systematic vascular resistance, or both. In the younger age group, the cardiac output is often elevated. Also, it has been postulated that in very early hypertension, the peripheral resistance is not raised, and the elevation of blood pressure is caused by raised cardiac output, which is related to sympathetic overactivity. However, most patients with essential hypertension have a normal cardiac output but a raised peripheral resistance. Peripheral resistance is determined by small arterioles, the wall of which contains smooth muscle cells. And prolonged smooth muscle constriction is thought to induce structural changes with sinking of the arteriolar vessel walls and leading to an irreversible rise in peripheral resistance. Renal angiotensin system also play a very important role in the pathology of hypertension. Renin is responsible for converting renal substrate to angiotensin 1, a physiologically inactive substance which is rapidly converting to angiotensin 2 in the lungs by angiotensin converting enzyme. Angiotensin 2 is a potent vasoconstrictor and that causes a rise in blood pressure. In addition, it stimulates the release of aldosterone from the adrenal gland, which results in a further rise in blood pressure related to sodium and water retention. The autonomic nervous system plays an important role in the control of blood pressure. Sympathetic nervous system stimulation can cause both arteriolar constriction and dilatation. In hypertensive patients, both increased release of and enhanced peripheral consistency 2 norepinephrine can be found. In addition, there is increased responsiveness to stressful stimuli. Dysfunction of the endothelium has been implicated in human essential hypertension. Vascular endothelial cells play a key role in cardiovascular regulation by producing a number of potent local vasoactive agents. It's including the endothelium, the nitric oxide, bradykinin, atrial natriuretic peptide. Endothelium is an endothelial vasoconstrictor, which may produce a salt-sensitive rise in blood pressure. It also activates local renal angiotensin system. Nitric oxide is produced by arterial and varus in endothelium and diffuse through the vessel wall into smooth muscle, causing vasodilation. Bradykinin is a potent vasodilator that is inactivated by an angiotensin-converting enzyme. Atrial natriuretic peptide is a hormone secreted from the atria of the heart in response to increased blood volume. Its effect is to increase sodium and water excretion from the kidney as a sort of natural diuretic. A defect in this system may cause fluid retention and hypertension. Hypertension is about twice as common in subjects who have one or two hypertensive patients, and many studies suggest that the genetic factors account for extremely 30% of the variation in blood pressure in the various population.